Now we shall be studying bandages for the lower leg. Knee bandage. Keep the knee slightly flexed. In this patient, a Gamgee bandage is rolled first for giving a pressure dressing to the knee. Take a 4-inch bandage. Take a circular turn above the joint and now take spiral turns downwards to cover and fix the Gamgee bandage. Then starting below the joint, take short figure of 8 turns crossing in front of the knee, moving upwards by 1/3 turn each time. Note the short figure of 8 turn. On reaching above the knee, end the bandage with a circular turn. Since the bandage crosses in front of the knee, it restricts the flexion of the knee joint and gives it rest. Reverse spiral bandage for the leg. Take a 3-inch bandage, start near the ankle and take 2 circular turns to fix the bandage. Bring the bandage forwards on the medial side at an angle of 30 degrees upwards. Reverse the direction of the bandage on the anterior aspect of the leg. Fix the upper edge of the turned bandage with the other hand till the turn is completed. Pass the bandage around the back of the leg. Bring it forwards again at an angle of 30 degrees upwards. Reverse the direction of the bandage. Hold it with the thumb. Go around the leg. Again come forwards with a 30 degrees upwards angle. Repeat the procedure till the entire dressing is covered. Reverse the direction of the bandage, hold it with the opposite thumb, go around the leg and again come forwards with a upwards 30 degrees angle. End the bandage above the dressing with a circular turn. To get a good looking bandage, turn the bandage at the same point in each spiral and use uniform pressure. Alternate reverse spirals. Fix the bandage below the dressing with 2 circular turns and take alternate simple and reverse spirals. Advance the simple spiral covering 2/3 of the previous turn and then take a reverse spiral rolled tightly at the same level as the simple spiral. The next simple spiral will again ascend covering 2/3 of the previous turn, followed by a reverse spiral at the same level. Alternate simple and reverse spirals are given when a tight pressure bandage has to be given, especially over a tapering part like the leg. Ascending figures of 8. With a 3-inch bandage, take 2 circular turns to fix the bandage near the ankle. Then bring the bandage upwards and outwards in front of the leg and downwards and inwards to cross it, completing a short figure of 8. Upwards and outwards, then downwards and inwards. Upwards and outwards, then downwards and inwards. Repeat these turns, each time moving upwards and covering 2/3 of the previous turn till the dressing is completely covered. Heel bandage. Take a 3-inch bandage and start at the center of the ankle joint with a circular turn. Take the second turn above the first, covering 2/3 of it, and take the third turn below it, covering 2/3 of the central turn. Now turn around the heel, then above the ankle, and then around the other side of the heel. End with a circular turn above the ankle. Note how snugly the bandage fits around the heel and the ankle. The important turns here are the diamond turns over the ankle and heel and the turns around the heel. Bandage for the dorsum of the foot. Take a 3-inch bandage and start with 2 circular turns at the base of the toes. After fixing the bandage here, take figure of 8 turns above and below the ankle, crossing on the front of the foot. With each figure of 8, move upwards on the foot, covering 2/3 of the previous turn. When the dressing is covered, end above the ankle with a circular turn. This is the final view displaying ascending figures of 8, compressing the dorsum of the foot and ankle. For bandaging the great toe, take a 1-inch bandage and roll the bandage around the toe to cover and fix the dressing. First a vertical turn and then circular turns. Now pass the bandage obliquely around the foot, coming above the ankle on the opposite side. Then behind the leg and crossing the bandage around the ankle and foot, come back to the toe. Once you fix it in this manner, the bandage will never slip. You can also limit your bandage to the toe and fix it to the foot with sticking plaster. But if the foot becomes wet with water or sweat, it will not stay. Elastocrepe bandage for ankle sprain. With a 4-inch elastocrepe bandage, start over the center of the ankle. Take the second turn to the base of the toes. And from here, take progressive figure of 8 turns, each turn slightly higher on the previous one. The ankle should be maintained in neutral position or in slight dorsiflexion. The bandage is moved once above and once below the ankle and applied tightly with uniform pressure. Particular care must be taken over the lateral and medial aspects of the ankle where the ligaments are sprained. After covering the ankle firmly, end above the ankle with circular turns. The extra length of elastocrepe bandage is generally not cut. Fix the end with the clips provided with the elastocrepe bandage. The bandage will compress the tissues and reduce tissue edema. It will support the contused ligaments and tissues and give them rest by minimizing movements. Elastocrepe bandage for varicose veins. With the patient lying down, elevate the leg to 45 degrees so as to empty all the dilated varicose veins. With a 6-inch elastocrepe bandage, take 2 circular turns on the foot to fix the bandage. Now take spiral turns, each turn overlapping 2/3 of the previous turn. The bandage must be stretched and applied with uniform pressure and should fit snugly to the leg. The bandage should reach and end well above the knee. In particular, it should support the calf muscles and keep them compressed. Fix the end of the bandage above the knee with the clips provided. And then only the leg is left down from the elevated position. The bandage is very important for prevention and treatment of varicose ulcers. Particularly, remember to empty the veins by elevating the leg before applying the bandage, and take care to cover the foot, ankle and calf very firmly. Bandage for the below knee amputation stump. Start below the patella vertically around the stump and back behind the knee joint. Both these points should be held firmly with the left hand, and the bandage is rolled vertically on either sides of the first turn. After the third turn, the bandage is turned more obliquely to run a circular turn near the end of the stump, and is then continued with spiral turns till the starting point just below the patella is reached. These spiral turns will fix the first few vertical turns, thus fixing the dressing in place. Now the bandage has reached below the knee joint and is ended with a circular turn. However, if the stump is short and tapering, this bandage can slip, hence it has to be fixed above the knee. Now we will see this second type of bandage for below knee amputation stump, which is fixed above the knee. First pass the bandage vertically around the stump, then turn it forwards obliquely to cross the first turn and cover its lateral edge. Now go round the stump, across the knee joint, around the thigh, and come out behind the stump covering the medial edge of the first turn. Repeat these turns around the stump, around the thigh, and again around the stump to cover the previous turn 2/3. Now cover the stump properly with spiral or short figure of 8 turns. Then end above the knee with a straight turn. Note that the bandage crosses the knee on the sides and allows the knee to flex. Bandage for above knee amputation stump. With a 6-inch bandage, start above the inguinal region and take 3 vertical turns around the stump to the gluteal region. Both the ends of the bandage must be held firmly with the help of an assistant. Now turn the 4th turn obliquely around the stump to fix the vertical turns. Take 2 circular turns to fix the bandage without losing the tension of the vertical turns, and then go across the inguinal region and around the waist, just as in the hip spica or hernia bandage. Now take alternate turns, once around the thigh and once around the waist, each time going around the thigh at a slightly higher level. Now the amputation stump and the thigh is completely covered, and we will end the bandage with a circular turn around the waist. So this is a combination of amputation stump bandage and hip spica. And this is the completed bandage for above knee amputation stump. Bandages for the head. Capelin bandage for the scalp. Cut a strip of bandage 80 centimeters long and put it across the vertex with 2 ends hanging in front of the ear. Ask an assistant to hold these 2 ends tightly downwards. Start with 2 circular turns around the forehead to fix the bandage. Now as you come forwards around the occiput after the second turn, pass the bandage around the hanging strip, turn around it, and now circle the back of the head at a slightly higher level to the opposite side. Then circle around the other hanging end and come back over the occiput at still higher level. And repeat. Turn around the vertical strip and go higher around the scalp. Repeat these steps till the entire head is covered. Then end the bandage with a circular turn. The important point here is that the assistant should hold both ends tightly and provide good counter traction. Tie the ends of the bandage strip under the chin moderately tight. This bandage will stay well even in infants. Now we will see the bandage from the side. Note the position of the vertical strip of bandage just in front of the ear. These are the 2 circular turns just above the forehead and ear and just below the occiput. Now note the bandage as it is moved higher over the occiput and the method of turning around the vertical strip. The bandage moves upwards and forwards on the scalp with each turn. The assistant must hold both the vertical strips under tension. And this will be the last circular turn to fix and end the bandage. Now we will see another type of bandage for the scalp. Start over the occiput in the midline, holding the end by the left hand. Move from the occiput to the forehead over the vertex. Turn the bandage back just above the eyebrow and return to the occiput. The points at which the bandage is turned back should be held with the help of an assistant. Each turn of the bandage should move laterally till the bandage becomes horizontal. The bandage is rolled on the right and left sides alternately. Now the bandage has become horizontal and it will be ended with a circular turn. The turning points of the bandage are fixed by these last 2 circular turns. At the end, pass a finger under the bandage at the forehead to free the eyebrows. The last circular turn should be tight enough to prevent the bandage from slipping. Now we shall see a third type of bandage for the scalp. This bandage is applied by 2 persons simultaneously, standing on either sides of a sitting patient. Take one 3-inch bandage and one 2-inch bandage. The 2-inch bandage circles around the forehead, while the 3-inch bandage covers the scalp. The assistant starts with 2 circular turns. Start the 3-inch bandage posteriorly, its free end being fixed under the second circular turn. Bring it over the center of the scalp to the front of the face, cross it here with the 2-inch bandage and turn it up back over the scalp. Every time the 2-inch bandage will cross it in front and behind, and it will be turned back to cover further portion of the scalp. Repeat the turns till the entire scalp is covered. The turning point of the 3-inch bandage is automatically fixed by the circular turns of the 2-inch bandage. End the bandage by tying the two bandages beneath the occiput. Now the 3-inch bandage has become horizontal and it will be tied posteriorly. Now we will watch the same bandage from the back side. First, the two circular turns of the 2-inch bandage. The beginning of the bandage is fixed under the second turn. Note how the 3-inch bandage is turned beneath the occiput and is advanced to cover lateral portion of the scalp. These turns are repeated till at the last turn the 3-inch bandage becomes horizontal and the two bandages are tied together beneath the occiput. And this is the final view on completing the bandage. Trefoil bandage for cheek and parotid region. Start with two circular turns around the forehead and occiput, going just above the eyebrows, above the ears, and just beneath the occiput. Now bring the third turn forwards from under the opposite ear, chin, and then over the cheek to be dressed. Proceed over the vertex and take 3 to 4 turns in this vertical direction till the entire dressing is covered. Each turn proceeds backwards over the cheek, covering 2/3 of the previous turn. Now end the bandage with 1 or 2 circular turns around the forehead applied tightly. These turns will fix the vertical turns and prevent them from slipping forwards. Free the eyebrows by passing a finger under the bandage over the forehead. And this is the completed trefoil bandage for parotid region. Mastoid bandage. Before you start the mastoid bandage, keep a 3-inch piece of bandage or an opened up gauze piece across the forehead in front of the ear. Now take a 3-inch bandage and take 2 straight circular turns at the level of the forehead, going just below the occiput posteriorly. In the third turn, pass the bandage down to cover the lowest part of the dressing and then upwards and forwards across to the forehead. Take the next turn slightly upwards, covering 2/3 of the previous turn, and repeat the turns till the dressing is completely covered. End the bandage in the front with a straight turn and tie the vertical piece of bandage around these turns so that the lower edge of the bandage is lifted away from the eye. To end, pass a finger under the bandage on the forehead to free the eyebrows. Eye bandage. Start over the injured eye, obliquely across the eye, covering the lower edge of the eye pad. Come out above the opposite eye and take a circular turn around the forehead. Then pass the bandage obliquely again, covering 2/3 of the previous turn, followed by a circular turn. Repeat these turns if necessary till the dressing is securely and completely covered. and end with a circular turn. Double eye bandage. When both eyes are to be covered, start with a circular turn around the forehead. Bring the second turn forwards obliquely across the eye, covering the lower edge of the eye pad. Take the third turn around the forehead. Now bring it from behind forwards beneath the opposite ear, across the other eye, covering the lower edge of the eye pad. Again repeat the circular turn. Now repeat these steps, each time covering 2/3 of the previous turns over the eye till the pads are completely covered. A circular turn around the forehead, alternating with oblique turn around the eye. Now each eye is covered with 2 turns of bandage, and the bandage can be finished with a circular turn. If further security is needed, the turns may be repeated. Note that the ears are not covered in the eye bandage. Here we end the bandage with a circular turn, and both eye dressings are securely covered. Bandages for the mandible. First we will study a four-tailed bandage. Prepare a four-tailed bandage. Take a 4-inch bandage with length sufficient to tie around the skull, and split the two ends, leaving a central portion of about 3 to 4 inches long. The center of the bandage is placed over the chin, and the upper two tails are tied behind the neck. Then the lower two tails are drawn up and tied tightly over the vertex. A central 1-inch portion of the bandage may also be slit in the center so that it fits well around the chin. This vertical portion of the bandage tends to slip forwards, so it is tied with the horizontal portion, fixing it in place. And this is the completed four-tailed bandage for the mandible. The upper tails tied behind and below the occiput, the lower tails tied above the vertex, and both of them tied together. Now we shall study another type of bandage for the mandible. Here a 3-inch bandage is rolled around the forehead, and a single knot is tied on the right temporal region just in front of the ear, leaving an extra length of the bandage to tie the last knot. Now the direction of the bandage is changed, and it is brought down and around the chin to the opposite temporal region. Here the bandage is passed one full turn around the circular band just in front of the left ear, and is then tightly pulled first downwards and then upwards to lift the mandible. Then it is taken across the vertex to be tied with the beginning of the bandage. Thus it forms a cross with a horizontal band and a vertical band. Now we shall see another type of bandage for the mandible. Start with a horizontal circular turn around the chin and back of the neck, below the level of the ears. Now turn the second turn upwards from under the chin, over the left ear, around the vertex, and in front of the right ear. Turn it under the chin to take a circular turn again. Take alternate circular and vertical turns. The circular turns hold the mandible backwards and the vertical turns hold it upwards. End the bandage with a circular turn. And this is the view of the completed bandage. Four-tailed bandage for the nose. It is prepared from a 2-inch bandage, leaving a central portion about 3 inches long. The lower tails are carried above the ears and tied behind and above the occiput. The upper tails are then crossed and carried below the ears to be tied around the back of the neck below the occiput. This is the final view of the completed four-tailed bandage for the nose.